We're back to the Neil Haley Show and also the Media Giant Effect. And I'm excited to welcome to the program Dr. Charles Simkovich from Simkovich Concussion Institute. Dr. Charles, what's going on, man? How are you?
Good. How are you?
Fantastic. And our topic today, we're gonna jump into specifically this type of sports injuries you've seen with head injuries and what types to expect. Again, a lot of times we think about football as always the concussion big sport, but there's lots of other sports where you see injuries like this.
Well, sports injuries, they each have their own unique properties. Football, you have the one-time big concussive event when there's a hard hit. Then you have the small cumulative effects of smaller blows, such as an offensive lineman, each play hitting their head. Then we have soccer. Soccer players are pretty unprotected. They head the ball, which, again, the cumulative effect of that's not great. They fall, they hit the hard ground. You have a phenomenon called coup contra coup injury. If you're jarred real hard, your head whips real hard, and the brain actually bounces off of the inside of the skull. Obviously, boxing and MMA speak for themselves. They're getting hit in the head as a part of the sport. The damage from that is bad. Any boxers I see or MMA artists actually need more work than the average person. We've actually had ultimate frisbee people in who have got injuries running into things. It's quite amazing. The stopping and starting of tennis players have run into the net and flipped. I actually have a lady from Wheeling, West Virginia. This lady has sustained 5 major concussions in 3 years, where she had to be looked at all 5 times. Her husband's a dentist. He actually will drive her up to see me as soon as it happens. But ironically, she was playing doubles tennis. Her partner hit her in the back of the head with a racket. The lady never saw it coming. So each sport has its own set of risks that are inherently involved with them. I have a lot of basketball players, elbows, knees, hardwood floor. No sport is really immune from the dangers of hitting their head. Track. I had that girl from North Carolina I talked to you about that had a 60-second memory. She
Right.
was cross country and fell. Cross country, it seems pretty benign, but she fell and hit her head, and she had a 5-year problem where she had a 60-second memory. For 5 years. She thought she was 15 years old, and she's the one I told you a lot of doctors told the parents put her in an asylum and walk away because she's not going to get better. And she flew up. She drove up from North Carolina, and her memory is fully back and intact. In fact, she got her driver's license and is working now. She's working in the workforce, which a lot of people never go back to work. And that was cross country. So concussions can come from anywhere. Slips and falls. I had a doctor to go through my treatment last week. He slipped on the ice and hit the back of his head. So obviously there's sports that are higher risk, but any activity where you're dealing with high rates of speed and changing directions to play that sport, you risk falling, tripping, and injuring your head. It's you can't get away from it.
No, you can't get away from it, and that's the thing. And then when to be concerned about hitting your head or not hitting your head. I mean, being 6'10", sometimes I do knock my head. It's not badly, but ducking, different things like that. So I bet you a lot of tall people end up hitting their head very seamlessly, nothing serious, hitting their head on something.
Yeah,
And
years ago I was
your
friends.
head and not, because there's some people think they have a tough noggin that it doesn't affect them. Why does it affect certain people? And that's a great question I'm going to ask is, when you hit your head, why is it certain people it affects differently than others?
Well, a lot of it has to deal with the angle of the blow. How many concussions have you had previously? Like, is this the one concussion that's the tipping point, or the blow that's a tipping point? Your temporal bones slide up and down on your parietal bones. Glancing blow to the side of the head might move the temporal bones more, as opposed to you're a little more protected if you take a blow to the front of the head. it all has to do with how the cranial bones articulate, how much are they going to move. Angles and speed of the blow are factors. Talk about speed, other sports are motorsports, racing sports, motocross, car racing, lots of injuries from quad. I have people who race quads and people who race motorcycles and motocross. High rates of speed, again, no different than automobile accidents, and they're wearing helmets, but the helmets only have a limit. They most of the time save you from dying, but the concussive event still transfers into your skull. But yeah, so to answer your question, some concussions cause more damage than others. All the factors that are involved. I was just talking to a lawyer today about car accidents because I'm presenting for a continuing ed class for him, and I was saying, listen, you can have 3 head traumas in one single car accident. If you're hit real hard, your head whips forward and backward. That's a coup contra coup injury, which you can have, which means no contact. The brain hits the inside of the skull. Your head can hit the side window in the same accident, or the headrest, which is a blunt force. And if the airbag is deployed, that's like getting punched in the face. Equivalent of a 20-gauge shotgun shell deploys that airbag because it doesn't come out slowly. It comes out fast to stop you from hitting the steering wheel. It's possible to have almost 3 concussions in one car accident.
So definitely. And when you think about all
are
those injuries and you think about those things, it's also you're saying, but you say the blow to the head has a lot to do with it. So what do you do if you have a sports injury, because we're talking sports injuries today, and you hit your head? Like when I used to take charges on basketball, I never hit my head. I knew to take a charge right. But some people didn't take the charge and their head went smack right on the floor. Do you automatically go and see you if that happens? Or what tests you kind of run yourself or have your trainers run before coming to see you?
Well, the trainers are, these athletic trainers are so well trained and educated now. They're very good at sniffing out concussions, and they're going to look at your eyes. They're going to see, are your pupils reacting to light? Are you talking funny? Do you know where you're at? Is your balance off? You're going to know, or the people who live with you, your parents, your siblings, your spouse are going to know, is your behavior different? Are you experiencing symptoms that you didn't have before the incident? Are you having headaches? Are you having a hard time reading? Are you having a hard time focusing your eyes? Are you dizzy? Is your balance off? Are you nauseated? Do you have ringing in the ears? So if you're experiencing any of those symptoms following a concussive event, that's when you really need to give me a call. And you're going to need looked at, because you can have short-term acute effects that might diminish a little bit, but the long-term effects are what you really want to protect against, because deterioration starts somewhere, and you're in more danger if you've had multiple blows, or if you've been playing sports all your life. If you've been playing basketball or soccer or football, you're guaranteed to hit your head or have incidents where.
So how many people never get their concussions treated?
I wouldn't even know that number. I'm sure it's a big number, because a lot of people don't realize, a lot of people don't tie their symptoms back to concussions or head injuries. I've had a lot of people in my office where I'm examining them, and they said, I'm having all these symptoms, but I've never hit my head. They forget. I had one guy, all the symptoms of concussion, and he had all the findings in my office, and he actually kind of got upset with me and said, I've never had a concussion. I don't know why I'm even here. My mother made me come in. And he wasn't real happy when he left. Well, he came back the next day and apologized. Here, when he was 2 years old, the springs on the garage door snapped, and the garage door slammed his head against the concrete, and he actually had a fractured skull. He was in a hospital for 2 weeks, intensive care, and of course, he was 2. He didn't remember, and his mother never told him. So we don't remember a lot of head injuries. Invariably, when I examine a patient and I make my findings, I say, here's what I'm finding. Here's what probably happened. Once we get into it, they'll come back and they'll say, oh my goodness, I forgot about this.
So this is the thing. If you played a sport, like all the sports we're talking about today, and you do have certain symptoms of a concussion, or of, I guess, of a post-concussion, meaning years ago, and you're developing traumatic brain injury in some sort of way, showing those symptoms and signs, there's still hope for you. And it's a good time to get it at your 50s in your before you go into having a chance, because if you don't get concussions treated, at one point in time, you could have dementia or Alzheimer's, right? You have a better chance of having dementia and Alzheimer's if you had severe concussions. Is that correct?
Right, because the glymphatic system, which is what cleans the waste out of the brain, does diminish in function after head injuries. And this was proven by Dr. Nettergaard, who's a doctor in Rochester, New York, who actually discovered the glymphatic system. She also did studies to show that the glymphatic system function slows down after head injuries. And the lymphatic system removes tau proteins, which is what causes CTE, and beta amyloid proteins, which is what causes dementia. So, it's insidious. It doesn't show up tomorrow. You don't hit your head and all of a sudden you have dementia. It's a deteriorating process. It takes years and years. It's one of the reasons why I've started working with the NHL Alumni Association, because the older fellows are having issues that creep once you retire.
So I think that there needs to be a checklist, and concussions is still something you think about that are a serious injury, right? Not almost everyone has had a concussion or never was diagnosed with a concussion. So what in our conversation, if we talked about any of these sports and you played them, and you have specific symptoms, which you need to go back and listen to all of our interviews so far to really build that checklist, which we're going to have that checklist available at SimkovichConcussionInstitute.com at one point in time. That checklist is going to tell you, if I have any of these symptoms and I'm thinking it's something else, I better get it checked out for concussion now, so that I'll see if my head, once you examine your head, you go in and provide that evaluation, people can see more, right?
Oh, right. And really the effects of a concussion are getting larger and symptoms and more serious the more we learn. When I started doing this work 30 years ago, we knew concussions cause pain, such as in headaches and cognitive issues, memory problems, reading problems. Well, now one of the cranial bones called the sphenoid bone actually houses the pituitary gland, and it's been proved by research. And CT scans and MRIs prove it all the time. I'll get results back from MRIs that say empty cella, which means they can't, the pituitary gland is damaged or smashed or torn. And the pituitary gland is the master gland. It tells everything what to do. It's like a general in the army. It gives orders. It controls hormones, heart rate, digestion, and all of that. So now there are many studies tying hypothyroidism to concussion because of the pituitary involvement, irritable bowel syndrome, hormonal problems. There's a good reason. I've talked about this in the past. It's not accidental that there's a high rate of erectile dysfunction in retired NFL football players. I saw a study that said 5 times more likely than the general population, and it's because of all the head blows. It's a real problem. And then you add to that the pineal gland is behind the pituitary, and that regulates serotonin secretion, which is what's amiss during PTSD. So when you start looking at the whole picture, you understand a lot of this comes back to either a concussion or multiple smaller blows that have a cumulative effect that you need to address. And a lot of people don't tie that together and say, hey, I think there's a lot of help for this.
So, and you can't say, I'm going to hide from football. You can't say you should hide from competition in sports. You just got to go see Dr. Charles before it's too late. And it's never too late, especially. So even if you're going through symptoms of not remembering, things like that, go see you. And I think that maybe our next interview, we need to go through and create the checklist ourselves in an interview and basically say, here are the symptoms. If you have symptoms like this, and even in the conversation, say, this is what other doctors are going to say if you have these symptoms. Oh, it's environment. Oh, it's this. Oh, it's that. Never bring up concussions when.
Right. I had a fellow in my office last week from, where's he from? I don't know, out near Philadelphia somewhere. Oh, no, State College, PA. And after he went through my induction forms and was checking off things and listening to other patients in the office, he said, maybe I shouldn't be here because I don't think I'm that bad. He said, I only had a few symptoms on your checklist, I didn't realize so many things can be from concussion. And it definitely were. He definitely was concussed. Just because you have one or two symptoms, they can be very selective. You know, he had headaches and dizziness and ringing ears. That's it. But they're disabling. I had another guy had a severe concussion. He was on vacation down in Marco Island, Florida, fell and hit his head. The only thing happened to him is he lost his sense of taste and smell. That's it. So, and I have other people have only headaches. I have other people who have every other symptom, reading problems, memory problems, brain fog, but no headaches. So it's a very individual thing. And people don't realize that because listen, I had a lady, she actually happened to be in the Tree of Life synagogue in Pittsburgh
Oh
when
my God.
up 4 years ago and 11 people lost their life. She was hiding in a bag of clothes. Well, she saved her life, and since then she was in a trauma. Her head hit tempered glass, and she had a severe concussion. She actually went to a work doctor who told her there's no difference between hitting your head on this tempered glass and getting hit in the head with a cotton swab. I couldn't believe the nerve of this guy to say that. It was one of the dumbest statements I've ever heard. And she's like, no, I never had these symptoms before I ran into this tempered glass and hit my head. And she was at work and the door was closed. It's not normally closed. And she was used to
Oh
go,
man.
and she hit the glass. But the nerve of this doctor to say there's no difference. And I've actually had patients too come in and say their doctor said, well, you weren't knocked unconscious. You don't have a concussion.
Oh my goodness. So
Yeah.
all these different things, Dr. Charles, and that's why people need to contact you today. Because what's so great about it is you do evaluations yourself. No one else is doing them. You do them.
Right.
You make yourself available. And supplies are always not supplies, but meaning your ability to treat as many people as possible. It's a true miracle. And best place people can find information is go where?
Yeah, Simkovich Concussion Institute.com. And not everybody needs treatment. I probably examined 20 different people last week, and 5 didn't have anything I could help. They were fine. And they happened to be tag-alongs with family and said, hey, while they're here, will you look at them? They had a few different incidents, but there was nothing wrong. I ended up not having to see them as patients. I had an Amish fella in this week. He said, my wife's here, take a look at her. There was nothing wrong with her. So that happens as well.
All right. Well, we appreciate it, Dr. Charles.
Thank you.
You're listening and
Looking forward to
watching. All right. See you next week. You're listening and watching the Neil Haley Show. And we'll be back in just a moment.